Right to the manufacture of the units, it was important for us to get an understanding from clinicians of what the needs and functionality of the units are. Aspen Medical has a clinical department that we sent our design plans to, and we asked for their consultation in relation to what they prefer the layout to be within the units. This went through to surgeons, to nurses, GPs, and also we sent our designs out to other medical staff that have worked with us on operations in the Solomon Islands and in East Timor. Aspen Medical chose Medical Designs to be their partner in the construction of the mobile units because Aspen Medical's had a long-standing relationship with Sergio Estevez's company, Medical Designs, in his operations in East Timor, the Solomon Islands and in Papua New Guinea.
When it comes to the design of the unit, we obviously had many options. We could design this mobile facility as a standard facility, as most health organisations in the country have come to put health facilities together. But we wanted this product to be far more durable than just a standard building which is made out of plaster boards and water-based paints and things like that. We understand that these units are going to be mobilised and used quite heavily, so we decided to actually make these units well above the Australian standards requirements and well above what we find across the nation.
The deployment capacity of our mobile health unit is quite extensive. We can use the unit domestically or we can use it in international areas. For example, if a local hospital is having a refurbishment, we can bring our mobile unit in. The refurbishment can be undertaken and we can continue to deploy our unit and the operating theatre capability within that facility continues. Alternately, if there's a disaster, we can deploy our unit to an area of disaster. The deployability of this unit is such that we can deploy it by truck, by train, by air or by sea. So having that availability to us enables us to be able to deploy this unit anywhere in Australia or in fact anywhere in the world.
When we originally designed the mobile health units, we ensured that we got advice from specialists in their field to make sure that everything from blanket warmers through to operating theatre tables were of the highest standard and met the needs of the clinicians in every area. And we've been delighted that as we've been rolling out MHU after MHU, the experience of the clinicians has confirmed that we got the design right.
The mobile surgical unit will make a huge difference at Moree Hospital. Previously, when we've had renovations done at the hospital, we have had to actually shut down our emergency and our elective surgery. So it really makes a difference with our waiting list targets. We still have to meet all the targets that New South Wales Health actually give us. And overall, it's just going to make the perioperative nurse's life much better because we're going to be able to still provide a service to the community. We have Australian standards that govern how we actually practice as perioperative nurses and also how we have ventilation systems in the health service, how we actually have filtration systems, how we sterilise things. And this mobile health unit meets every standard. It actually goes over and above the standard. To have like theatre lights that are state of the art, you know, you can see to do your procedures better. The benefits to the community, we just can't measure that because to be without an operating room service at a hospital for 18 to 20 weeks just can't happen. Like it could mean a person could die. This unit will save lives.